everyone. We're here with another edition of Startup Report, focusing on the Tampa Bay Wave Tech Diversity Accelerator and sponsored by Nielsen, supported by Nielsen. And today we have another Joe with another very nice beard. This is a couple of Joes with a couple of nice beards. Joe Hodges of Cara, Vale. Welcome, sir.
Yeah, thanks, Joe. Thanks for having me. Beard's looking sharp there. I like the look, the Santa Claus look that I've got going. I think I like it. It's the feeling of having it earned, you know?
Yeah, yours looks a little healthier than mine. Mine looks like maybe I've been in the woods for a few weeks or something like that. But so first, let's start with you've been in the Tampa Bay scene for a while. Why now? Why'd you find your way to this Tampa Bay Wave effort?
Yeah, you know, it was interesting. I've never applied to one of the tech cohorts, and I've had a few startups and some nice exits. And I really thought, and I've been mentoring, these startups for a long time, and I thought it was important to really be a more effective leader and advisor and mentor is to actually go through the process myself. So I have a new startup, and I like to think I've done things on my own before, but the reality is that it's always been based on the support of the people around me. And I thought, what a great opportunity to take advantage of the support network that exists here. It's massive, and it's a rare opportunity to be in a position to have so many incredible advisors to reach out to, touch, build relationships with, and then literally springboard what I'm doing in this new effort.
Great. So let's talk about the new effort, Cara Valet. Can you talk about what it is and what drove you to start it?
Yeah, so at Cara Valet, it's a digital healthcare platform that connects consumers with their providers of care. And we're revolutionizing the healthcare environment through creating transactional relationships between the provider and the consumer to disrupt the way that people are seeking and receiving healthcare. And it serves, kind of in a similar fashion that Priceline.com does, in solving a consumer need and solving a provider need, a hotelier's need to getting consumers. And our goal is to really create a platform that gets those physicians and those people that need services connected in a really easy fashion.
Interesting. So with Priceline, the gap they're trying to close is spare capacity and the consumer's flexibility and desire to save some money. So what's the gap that you're closing using the Priceline analogy with Cara Valet?
Yeah, that's such an important question to what's happening in the healthcare market today. So today, while we feel and hear often how busy physicians are and healthcare services are, there's always a percentage of openness and opportunity or canceled appointments or last minute appointments. And Cara Valet is designed to connect those consumers to those providers of care and to those open appointments on a cash basis. And typically a lot of people know, or some don't know, that paying cash for a service with a provider is a direct payment to them. They don't have to file a medical claim. They don't have all these other services associated with creating such a large bill from an insurance platform. But if you pay cash for it, they can offer that service at a much lower cost because they're getting paid for it, not only just the cash aspect, but they're getting paid for it immediately on delivery of the service instead of having to go through the whole billing process.
Yeah, it's amazing how powerful that can be. Sometimes I've had some things done that were 30 to 40% less as a cash payer than it would have been just to pay the deductible portion of the insurance. It's quite amazing.
Yeah, when you look at it as an example at MRIs, you can pay $800 to $1,500 for an MRI through insurance. Now, the insurance may not pay that directly to the provider, but that's what's billed out. But as a cash payer for receiving an MRI, you pay somewhere around $150 to $300 for a direct cash payment for that. It's a significant, chop off of what's billed or even what's paid by insurance.
Right. So with you continuing down the Priceline road, what does the interface look like on the provider side as far as certain services they're offering, and then how often do you expect them to update their pricing, or is it algorithmically put in there so that as the opening comes sooner, the price lowers, or how does that work on the back end?
Yeah, so that's where we're going in the development of Cara Valet. So we're in our early stages of this, but we built a B2B model to go out to the market with to help connect current insurance programs with their providers and simplify a few things that there were gaps in the B2B market with, which number one, on our platform, we have all the networks loaded in the background. So any network that's available in the United States today, we can load. We have all of the providers, hospitals, doctors, anyone that has an NPI number, we have loaded in the system. Then we connect the networks to that. So let's say that your employer has a health plan and they have a Cigna network on there. If your employer purchased the Care Valet, you're able to go into Care Valet, find your provider of care, schedule an appointment with them directly, it through the application, get directions to their facility. Even if you need a ride there, we have ride sharing services connected right in the background that you can just take to get there. But we've also included telemedicine in there. The majority of emergency room and urgent care visits, they about 70% of them are unnecessary. So having a telemedicine provider available, they can take care of a good portion of those needs and call in a prescription for that consumer or whatnot. Our goal was really just to create efficiency, but to really build the tool in such a simplistic way that the consumer only has one or two button pushes to get to the solution that they need.
So with the B2B model then, is it you're not looking then to monetize each individual transaction? You're going on a subscription model?
Yeah, so it's a subscription model on the B2B side and fulfilling a need. There's really no great front-end tools right now for consumers to use to get connected with their healthcare services. And so we're solving that need first. And the ultimate goal is moving into that B2C side and then really solving a much greater need.
And it sounds like you're mitigating a lot of your customer acquisition costs by tapping into networks in the beginning stages. And then, once you get your feet under you, then that's when you go for the B2C, which is going to be a little more expensive.
Yeah, the way that we're really tackling this out is that having the networks in there, number one, is important, and then getting the business online. So selling through these third-party administrators or health plans or even employers that want this for their employees. Once we really tackle down a market, so let's say that we get the Tampa Bay region and we have a large group of employers that are here, we now have those relationships between the employer or patient and the providers, which then allows us to really push through with our B2C model and make those greater connections for those that are uninsured, or want to pay cash for their care.
So when you bring in these elements to the platform, you're talking about telemedicine, and there's obviously a lot of data slinging back and forth. So how much of that are you hoping to keep all of that off platform? You're simply referring through to other people's telehealth platforms, or are you hoping to actually hold a lot of that data and those connections on the Care Valet platform?
Yeah, right now we have some telemedicine partners that serve in the back end to manage the telemedicine call. But the reality is that some physicians do want to have that telemedicine relationship. So we actually have tools that we're building when we get to that B2C side to create that direct provider relationship with their providers, with their consumers or patients, so that they can better connect with them and just have a conversation face to face to determine if they even need to come into the office.
Great. So what's been different about this startup? You said you've had a couple of exits in the past. This one you're coming in, you're going through the program, you've got a heavy technology element to this. What's been unique about this particular iteration of starting a company for you?
Yeah, I've only worked in the B2C model side, and the last company I had, we did. It was a care management company and a claims management and clearinghouse service. So we worked directly, primarily with the insurance side. So that B2C was representing them while providing some consumer services. The one thing that I noticed there was that there was such a gap in the way consumers first reached out to care. So every time, let's say we got a case to help manage for someone who was diagnosed with cancer or cardiology, they were a cardiac case, or they had asthma and they needed services to, work through, managing their health. We always found out after the event occurred. So there was never any front-end communication to even help guide the consumer to making a choice that was simplified for them. So I went out and looked at those tools that are offered to them, and you go pull up I need a dermatologist, and you get 100 of them listed locally, and you're like, who do I go to? Who's closest to me? How are they rated? Which one should I choose? And people fall into old behaviors where then they call a friend. Who have you used? Who do you know? And there's a better way to do this.
Sure. Yeah, and it's the same. Getting the customer that early in the journey gives you so much leverage and pointing them to so many different solutions. Even to your point, even down to just how they get to the hospital with the the rideshare service. People love to do this in the real estate space as well, because once they know someone's looking for a house, then they can point them to everything from mortgage to agent to broker, and you get a lot of flexibility when you start to provide value at that point in the customer journey. And then gain their trust and become that utility for them.
Yeah, 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 absolutely. And it's physicians want those better relationships and want more of a personalized relationship with their patients. And the same thing with patients. As a matter of fact, the thing that really helped us guide us in the development of our program was there was a Deloitte study done in 2016, and it was called Consumer Priorities in Healthcare. And in the consumer priorities of the healthcare, there were 64 data points that consumers pointed out as being the most important needs that they wanted to have taken care of within the healthcare system for them. In those 64 data points, they were bucketed into 4 categories. And the first category was consumers want access to their physician on their terms, 24/7, 365 as they need it. Then they want some level of quality information. They want potentially some level of valuing information, whether that's cost or ranking or something along those lines. And the fourth thing they wanted was a consolidated digital platform. The biggest and most confusing thing that we found out of this was that you can go to any number of places to find physician information, but if you want any sort of metrics on reviews or quality metrics, you're going to this platform or Health Grades or something else. And there's some great tools for that, but they all sit independently. And our goal was to consolidate that, but to look literally taking Kahneman's, theory on system 1 and system 2 thinking, and find out, because they said their digital platform, they needed it simplified. So this is why we have the sort of 1 or 2 button push rule. We look at the number 1 priorities of consumers and what they need to tackle, and we put it in that order for them so that they don't have to go searching or reaching out or going outside the platform or even going deeper than 1 or 2 button pushes to get their need resolved.
Yeah. I'd be just happy if you could find a HIPAA compliant way to transmit the data so that you didn't have to fill out the same 70 forms for every single doctor that you visited, every specialist.
You'll be surprised what you see coming down the line.
So let's talk a little bit about the scene here in Tampa Bay. How have you seen it evolve, coming through the companies you had previously and being close to Wave and what's your feel for where we've come and where we're going in the Tampa Bay startup scene?
I've not only traveled all over the nation, but all over the world. I was living in Germany last year in Munich. I was fortunate that my landlord happened to be the director of Plug and Play in Munich. And so I got to spend a lot of time over there. So looking here and seeing where things were, 1998, I started my first healthcare company. And the support services were really limited. There obviously was nothing like the Wave or no venture forums or anything, no startup forums or anything that you could really get engaged with. And it was all the traditional model. I think one of my first things I went to the Small Business Association and how do I get support from the SBA and it was challenging. But seeing organizations like the Wave, develop and grow over the last 10 years, and then seeing following organizations like Embark Collective and all of these support networks, seeing Mark Blumenthal put together Synapse and really try to create a voice for the region to help get public and private partnership together to support startup companies like the one I'm starting and like the ones that all of these other amazing people in the Nielsen cohort are bringing forward. The atmosphere is changing, and it's changing very rapidly. The beauty is we don't have to be a Silicon Valley, but we do need to be our best support by getting public, private, and government, the government entities understanding the value of promoting growth in business, and particularly in the tech sector. There's a great deal of opportunity for any state or city government to be supporting this, because many of these companies, or some of these companies, are just depending, turn into very successful businesses, which either help locally the economy grow, or even more globally help the economy grow, as we've seen some results.
Sure. Wonderful. Well, I've enjoyed the conversation. Thanks for continuing fire companies into the ether. And I
Yes.
hope this one, and I'm sure this one will be as successful as the previous ones. And hope to catch up maybe in person if they get to do a demo day, but otherwise we'll see you around.
All right. A pleasure. Take
Thanks,
care.
Joe.
Thanks so much.